And we are back today with Dr. Cynthia Snider from Cone Health. She's an infectious disease expert who could answer all of your questions related to the pandemic as well as these emerging subvariants. We've been talking about this latest one here, Dr. Snider, and we've also been hearing about how some of the vaccines coming out in the fall may be more helpful, beneficial when it comes to these new subvariants. People might be wondering, well, should I just wait to get a shot until those come out? What would you say to that?
I think we don't have the exact time frame of when the newer vaccine formulation is coming out. So I am a proponent of, if you're ready, if it's time for you to get your booster, this is a good time to get one.
We've been getting some text questions here. One of them, this person is asking, what makes this new subvariant so contagious?
It has, in a way, morphed. You know, when we think of the different subvariants on a limb of a tree, that this one is quite different. Still on the same limb, like that Omicron limb, but it's definitely a different branch than the first Omicron variant that we saw in the beginning of the year. So much so that that difference in the spike protein means that the antibodies that your body has produced is probably not sufficient enough to definitely to prevent getting infected from this variant.
With this new variant, are you seeing any symptoms that differ from other versions of this virus?
You know, I think that's an excellent question. We are seeing folks that really talk about more like upper respiratory illness and also can have a significant sore throat, like pharyngitis-like. And so at times people may think, you know, this is some other virus, but can be the presentation of COVID illness.
Any symptoms that we, you know, from the original version of COVID that you're really just not seeing anymore?
We are still, I don't think we're seeing as much of the GI illness aspects of it. And also, we are not noticing the upfront of just loss of smell and taste. You know, that seems to be a symptom that happens later on. Still, a lot of people are talking about congestion, fever, headache. Those seem to be the more common symptoms that we're seeing now.
Without knowing exactly how this situation will evolve, do you expect the trend to continue like it has in previous versions of the virus where it spikes and then quickly comes down again?
We were hoping to have seen that earlier on with BA2, but it's almost as if we're having a surge within a surge. And based on how infectious this is, there's a good chance that we'll seeing a trend down over the next few months. However, there still seems to be newer subvariants that are circulating. So I think it's difficult to tell that there'll be a low period in the coming future.
Someone texts us wondering, are COVID tests, the ones at home really, or the ones you can get from a professional, as effective as detecting the new variant?
We are still very lucky that the antigen tests that are available over the counter are still very good at detecting this illness. But again, the sensitivities of the over-the-counter tests, they improve if you do them on sequential days. So if your first test is negative and you're still feeling poorly, it makes sense to repeat it the following day or the day after. And then you can still get a PCR test, which tends to be more sensitive than the antigen test.
Someone's wondering, do you foresee another round of boosters being approved?
Yes, I do.
Do you know a timeline on that, or if you had to guess?
I believe they're discussing that currently, and I anticipate that there'll be some decision for a booster for those, you know, under 50 years old in the coming month.
What would you say? Someone texts us saying, what do you say to people who think the vaccine doesn't work because they've been they have the vaccine, but they've gotten COVID multiple times?
That when they studied the vaccines, it was really to prevent severe disease and hospitalizations and death. So even though that the latest subvariants have placed people at risk for getting, reinfected, the fact that they haven't been so severely ill that requires them to be hospitalized still tells me that the vaccines are still very effective.
We often hear people say that, boy, this is just going to be kind of like the new flu, where every year we're going to have to get another booster shot. Do you foresee that happening?
I would say that that's probably pretty accurate. I don't think we are out of the woods yet. There's still a proportion of the population that may have not yet had COVID, and then also there's still the proportion of folks where there's a lot of folks actually that have yet to have received their second booster to really increase that person's immunity or protection of becoming hospitalized. So as I think the hope is over these next few years, as the number of the severity decreases and more people have more general immunity to it, then it becomes kind of like a regular respiratory illness. But I would say for the next coming couple of years, I think receiving a booster, be it every 6 months or every year, is definitely in the cards.